Hi and welcome to my channel. I am Fungai Ndemira, founder of Checkup Health, an entrepreneur, a philanthropist, and now a tech disruptor. Today, I want to talk to you about a topic that led me to becoming a tech disruptor, because on my journey, never even a single day did I think I would become a tech disruptor. But this journey was born out of a very difficult personal experience. And I want to look at this personal experience and see how it relates to health inequalities, as I believe that digitization is one of the biggest things that can help reduce the health inequalities and hopefully narrow the widening gap of these health inequalities. My father and my father-in-law died a week apart, and guess what? They both died in 2004 from undiagnosed diabetes. You can imagine what we went through as a family during this time, where you have got the key people in two families all disappearing just like that, due to diseases that are preventable and that could have been managed. And so from that time, I began to have a burden on my heart. Why was these diseases causing so much death? And further, research showed me that these diseases are more prevalent in ethnic minorities than they are in the white population. And that took me on a journey of research, and I wanted to understand why. I wanted to understand why they were more prevalent, and more so why they were causing more deaths in ethnic minority men across the globe and how they are associated to hypertension. As I researched further, I realized that research has shown us repeatedly that in the UK, health sector has an inequality issue. And ethnic groups across the United Kingdom struggle to access healthcare. They struggle to deal with adverse experiences with the healthcare system. And they face inequalities, outcomes compared to others. I also realized that racism, either structural or interpersonal, negatively affects the mental health and physical health of millions of people, preventing them from attaining their highest level of health. And consequently, it affects the health of the whole nation. And in my case, it had affected my father-in-law and my father. A growing body of research shows that centuries of racism has had a profound and negative impact onto the communities of color. So I believe that urgent action is needed, especially during this time wherein we are moving into a digital era, where healthcare and accessibility is now coming online. With these inequalities so complex, it means that if they are not addressed through the digital transformation process, they will continue to widen, and the bigger population of the ethnic minorities are going to be left out, and their health is going to be impacted even more. The COVID-19 data shows that Black, African, Afro-Caribbean, Asian, and minority ethnic persons in the United Kingdom experience the highest rates of COVID-19 related hospitalization and deaths compared with the white populations. In my own family, we were surrounded by such a dark cloud because we lost those we love, older and younger. And it was such a difficult time to go through. So I can totally relate to what has been mentioned in the report. So with such data and information, I was led to look into this further and think about what is it that we need to do during this time of digitization that can help towards narrowing the health inequality gaps. And that's why I came up with my model, which I've called the All Dots Health Digital Transformation Model. It looks at addressing 6 areas of inequalities. I am now going to present you these 6 areas of inequalities, and hopefully by the end of the presentation, we can all work together towards reducing the health inequalities gap. Number 1, inequitable access to user-centered technologies designed for every patient. In the era of the times that we are living in, we have to think about creating solutions that are culturally competent and that looks at the language and the understanding of the end patient user who is being aimed to use the product. Therefore, to harness the digital tools for health services to reach and engage with everyone, it means that even those people in the hard-to-reach areas should be able to have technology available to them that is aimed in terms of their culture, in terms of their languages, so that they will speak to them in a sense that they will feel comfortable to use the products. Number 2, inequitable access to medical expertise. Now, this one is a very difficult topic to discuss because as service providers and services, it's very difficult to find the balance between having culturally competent people who can look after a certain demographic. For example, I am an African person with a dark skin. And I would feel more comfortable if I had a skin problem or if I have a female related problem that probably relates to my culture. I would feel more comfortable consulting a clinician who probably looks like me because I'll feel confident that they are going to understand my problem. Another example is when I was speaking to other professionals who have taken sick due to mental health challenges. When they visited a practitioner at the hospital, they were faced with a practitioner that didn't look like them. And by the moment that they were seeking to be consulted, they felt that this practitioner wasn't going to be able to understand their problem. And for sure, after the consultation, they left the place empty, feeling as if the person was feeling powerless to help and support them because the mental health problem that they had presented with was related to cultural beliefs and understanding and social issues that were surrounding this professional. So this is an example that I can give to say that as service providers, as we are looking to offer services and digital tools for different patient groups, we have to think about having the right people who are going to speak to the demographic that we aim to serve. Therefore, that's where artificial intelligence can come in and play a role. If artificial intelligence is developed by people who understand the cultural norms and the beliefs of the intended patients, artificial intelligence can go a long way in helping meet the cultural competency of a technology. Artificial intelligence can help also in terms of structuring the language within which a certain solution is going to speak to a patient or an intended user. So I would think, as for service providers and for technology developing companies, to think deeply about the user experience and maybe hiring the qualified user experience personnel. Number 2, inequitable access to medical expertise. Many ethnic groups face issues finding healthcare providers who can communicate effectively with them. Communication is a crucial factor in receiving the healthcare one needs. So struggling to find a doctor who can understand and communicate with the patient can be the difference between receiving the care the patient needs or not. While language barriers can create great difficulty in a doctor-patient relationship, so can competency in the patient's culture. Different cultures hold different health and healing belief systems, view diseases and illnesses differently, and hold different values when it comes to healthcare. Having access to a competent doctor in one's culture should be a given, but it's difficult to come by for some. This is where I think artificial intelligence will play a role. As providers and technology solutions providers develop technology, this is an opportunity to include artificial intelligence and machine learning and take advantage of creating a user experience team that is multicultural and multi-ethnical to ensure that as the technology is being built, within the user experience components of the solution will be weaved in the cultural competency and the linguistic competency required to make the technology relevant to the intended patient user. Area number 3, inequitable access to reliable, trusted health information. One study found that only 52% of Black and Asian groups within the UK reported clearly understanding minimizing the risks of contracting or spreading COVID-19 during the pandemic, compared to 71% of the white population. The Public Health England review even acknowledged the difficulty in interpreting and understanding the official notices and guidance provided about COVID-19. Access to easy-to-understand health information is crucial to the health of our communities. Yet, our health notices and information are inaccessible to so many communities due to their complexity in delivery. Access to information would improve access to health for investigations, for adoption. It will help improve the uptake. It would help improve analysis of data. It would help prevent diseases, and it will help with the development of our nation. Area number 4, inequitable support to access health monitoring preventative tools and interventions. Every patient has a right to access the tools that can help and support them improve their health outcomes. Therefore, service providers and digital tools creation companies must think about how culturally and linguistically competent are their devices. Patients are willing to use the devices, but there is always a barrier because the devices that are available on the marketplace may not necessarily speak to them in terms of making sure that they understand the language within which the product is written in. Secondly, the user experience of the product. Does it speak to them as a demographic? And if the product doesn't speak to them, you are going to find that uptake of these products and these solutions is going to be very low. Area number 5, interoperability and collaboration. I believe that health IT service providers and stakeholders can form amazing partnerships to deliver data-driven health improvement solutions. They can explore innovative ideas and efforts to exchange information and see how they can interoperably work together to serve the underserved communities of the ethnic minorities. And as they do this, as we know, this process can be difficult and laborious, but it is so worth it for them to consider this so that the widening gap of inequalities can be addressed as we digitally transform. As it's already difficult for the patients to be using so many devices to manage their health or even monitor their health at home, interoperability will make it easier for the patient because it will improve their experience, making it much easier for them to use the devices that are coming available to them to preserve their health. Area number 6, inequitable representation in public health systems and services. Information systems and the data they collect often do not equitably represent populations. For example, undercounting members of vulnerable communities or not collecting the right data to diagnose inequalities in the health system. When data is not representative and inclusive, the analysis and the use of this data will be inherently inequitable. But when thoughtfully designed, digital technologies can improve representation within health system data and increase access to health services for individuals otherwise disenfranchised from care. Therefore, improving the products, making them culturally and linguistically competent, will definitely improve the trust of the users of the products and will improve uptake of the product. Thank you for listening to my presentation. On a closing note, I would like to leave you with this thought. Can digital transformation help address health inequalities? I would be keen to hear from you. Leave a comment below this video or let's connect on LinkedIn and continue these conversations as we work together to make the world a better place and reduce health inequalities. Bye-bye.